So today we're going to be speaking about skills gap and part of our company Proficien, which is helping promote skills retention within healthcare organizations. And we're going to be going for about half an hour or so, and we'll get onto it now. So how does the webinar work? So the session is being recorded already. If you can please stay on mute throughout the session, and if you've got a question, there's a question and answer section at the end where you can ask any questions that you want to. Otherwise, if you've got questions during the presentation and you want to get the questions out to me before, then please put on the chat box or the chat, and I'll try and get to those questions if I can throughout the session. Otherwise, we will just answer them all at the questions and answer section at the end. And if you've got any technical issues, please, the team is available and you can just put the questions in the text box and we will try and help you with those issues. Okay, so just to do a quick introduction, my name is Nathan Conradi. I am the CEO and the founder of Proficien. I am a previous or current paramedic. I studied to be a paramedic. I've got a master's degree in emergency medicine, and I'm originally from South Africa, and I moved to the UAE a couple of years ago. And we started Proficien about 2 years ago, and we've been building ever since. And these webinars are part of a series of educational activities that we're doing, partly to get the word out about the skills gap and some of the solutions that we're trying to solve, but also to promote our company and some of the features that we have on our applications and some of the services that we provide. So what we're going to be speaking about today is we're going to be speaking about clinical skills gap. What is it and why is it relevant? We're also going to be speaking about some effective strategies and solutions, as well as Proficien and our services and how we go about creating better healthcare providers. So before we start the webinar, we're just going to do a quick poll. So if everyone can just download or just click on the link. It's also going to be on the chat. It's going to be put on the chat. So just if you don't mind completing the poll, I'm going to give you just a minute or so. It doesn't take too long. But we just want to see where you're at. And we've got some few questions about a skills gap and what youth want to get out of this webinar. So if you can do that now, I'm going to give you a few minutes just to do that. It's very quick. If you can just download it now, and the link is also in the chat. I think everyone should be done. It's very, very quick, the pre-webinar poll. So if you can do it now, if you can't, then just, or if you haven't done it yet, just do it while we are speaking. Okay, so what we're going to get into is what is skills gap and why it's a problem. So one of the major issues with having a skills gap within your organization, and this is sort of the main problem and related to the patient outcomes, is that it can lead to medical error. And I think that is one of the most important aspects of a healthcare organization, is ensuring that our patients are treated most effectively, have the best treatment, and the least amount of medical errors that we can make in our organizations, the better. Having skills gap can also lead to time delays or treatment delays for our patients. Again, sometimes these are critical, where we have a patient that requires a certain treatment, especially in the emergency care setting, emergency medicine side. If we delay treatments in certain ways, we can make our patients have worse outcomes. If we have skills gap, we can have workforce burnout, where our workforce just aren't feeling up to the challenge of treating patients. And we know that practitioners that are not confident don't treat patients correctly. So that sense of always having to learn or not knowing what you're supposed to be doing, that can lead to burnout, and it's a major problem. And then obviously on the patient side, we have safety compliance risks, and we're going to speak a little bit now about how to quantify some of these risks. But ultimately, every time we have someone that doesn't know what they need to do, we have a risk to our patients, a risk to our organization, both, ethically in terms of treating our patients the best way that we can, but also financially, where we can be, an organization can be at risk of medical litigation or malpractice litigation. So how do we quantify these risks? And I think if you are from a big medical organization and you haven't gone through some of these processes, you may not know what your risk of your skills gap, and then potentially on the medical legal side, what is the financial risk that your organization may be bearing. So there are a lot of ways that we can quantify this risk, and this webinar is not really about how to quantify these. Maybe I'll do another webinar sometime about quantifying risk, because that's a whole another webinar by itself. But if you're from a big organization, you might have seen some of these techniques being used in order to understand how much risk an organization, or quantifying that risk that an organization might have. So if we look at, we might have malpractice claims. So we might look at previous data where we're looking at the frequency, severity, the type of claims that are being made against the organization. One of the issues with quantifying this risk is it's already happened. So this is a retrospective way of looking at your risk and saying, well, in the last year, 2 years, 5 years, had these certain amount of medical legal claims. Some of them were severe, not as severe, and different types of medical legal claims. So the first way that I want to discuss is the malpractice claims looking backwards. And then we can have patient safety indicators. So you can look at different indicators along the patient's treatment. So post-operative complications, for example, healthcare associated infections, if you've got those, or medication errors. So you can look at a bunch of these indications. You can look at all of those indicators and add them up, and essentially understand how at risk your organization is. Mostly these are looking at these kind of smaller complications that will ultimately lead to bigger, more severe malpractice claims that could go against the organization. Then if you're from a large medical organization, you certainly have had these kind of compliance and audit scores that you can use. So that is a way that a clinical governance committee or a QA committee, quality assurance committee, can create a system where they check certain aspects of an organization And according to that score, how many you score for your unit, or maybe as a practitioner, or maybe as a hospital, that can tell you at how risk you are of a medical malpractice claim. And then you can also have incident reports, systems where if there is a near miss or there is a medical error, that it's reported. And again, you can look at that data retrospectively and see how at risk your organization is by seeing how many of these maybe near misses or how many of these smaller errors take place. So this is just a little bit on quantifying risk. Again, there's many ways of assessing this and trying to come up with an actual number on how risky how at risk your organization is. But if you as an organization haven't gone through this process of quantifying your risk, you may not understand exactly what your liability is in terms of medical malpractice and skills gap. So what are some of the solutions? This is obviously not an extensive list, but some of the solutions that you can do in order to help your practitioners be as caught up or as current as possible. So the first thing that we can speak about is doing a continuous needs assessment. So this is where we have an organization will go through the process of quantifying risk, but will also go through the process of looking at the issues that are at hand in the organization and trying to understand how to fill those gaps. A great way to increase skill proficiency or currency is through personalized learning, where we have learning that is personal, but also targeted at certain members of the organization. And this could be for whatever reason why. Maybe if you're working in a certain unit, or after a certain period of time, you have to go into the skills lab and do a skill or something like that. So really trying to not just have these broad learning where everyone has to do certain types of learning, but also to make it more personalized. And accessible resources, so having those resources at hand with when the practitioners are actually treating, or making it accessible and easy for them to get that kind of information. Very importantly, performance tracking, so understanding the currency of your staff members, understanding their need for updates. So if you're not tracking something, you're not going to be able to get a solution to it. So performance tracking is very important especially for these big organizations that have thousands and thousands and thousands of staff members. How do we actually track one staff member and make sure that that staff member is compliant and current throughout their time in the organization? And then leveraging digital tools. So in healthcare, we seem to be quite far behind other industries that have a lot more targeted, have a lot more technology integrated, especially on the kind of platform side and clinical learning side. We don't have those types of technologies within our organizations. So we seem to be lagging slightly behind other organizations or other fields. And if you can look at how many medical errors happen in surgeries, medical organizations, as opposed to in the aviation industry, we can see that there's a big disparity. And there's many more errors that take place in medicine as opposed to in aviation. So there's a lot of scope for us to do this better, and some of these digital tools can help us get there. So now